Our next career opportunity makes you part of the frontline surgical team and lets you assist in high-stakes situations that require clarity, confidence, and quick thinking. The team from HCA Midwest in Overland Park joins us with a look at the important roles you could play as part of the surgery team.
Hi, I'm Linnea Julian. I'm the Administrative Director of Surgical Services here at Menorah Medical Center.
I'm Tiffany Purdue. I'm the Clinical Nurse Educator for Surgical Services.
My name is Tarek Khalil, Robotic Team Lead, Scrub Tech.
Nancy Pippert. I'm an RN. I work here in pre-op surgery.
I'm Tamara Stevenson. I'm the Surgical Liaison here at Menorah. I work with volunteers and we work at keeping the family members updated on where their loved one is in surgery.
This is my 30th year of nursing, and I have spent all 30 years in the operating room. How I got there is I received my bachelor's Science of Nursing from Graceland University. Coming out of nursing school, I actually found my job in the classifieds, and which many people don't know what that is anymore. But St. Joseph, Missouri had the opportunity to take graduate nurses, and they were going to start a program 30 years ago to train you to be an operating room nurse. So I was very fortunate to be selected. I then had the opportunity to, I was approached about a new position that the operating room was going to have at North Kansas City Hospital. That was going to be a board runner. So they asked me to run the board, loved it, still to this day my favorite job in the operating room. So I ran the board, and then my leadership started kind of evolving at that time. I never thought I would be a leader or want to be a leader, but I was approached for every one of my positions. And then next was supervisor of the operating room, which brought different tasks. I was in charge of staffing the operating rooms, making sure that the cases were running smoothly, that the day went the best that it could, and also that we had phenomenal patient outcomes, that it was really my responsibility to oversee all those opportunities throughout the day. Then I went to HCA and joined them as a director of an outpatient surgery center, and then ultimately was approached again to see if I would like to come to Menorah Medical Center to be the director there.
I started at the University of Central Missouri and got a bachelor's in education. From there, I worked in a preschool, did the education role, and then I got a job at a hospital working closely with nurses. From there, that's when I decided I wanted to be a nurse for the fact of the variety of nursing roles you can hold. And so from there, I went back to nursing school as my second career, got my degree from Research College of Nursing. From there, I knew that regular bedside nursing wasn't for me, so I took the non-traditional role in a sense and went straight as a new grad to the operating room. Loved it, did that for about a year, and then was approached to become an educator or think of the idea of being an educator, and I accepted the role here at Menorah as an educator.
I went off to college, four-year university, didn't know what I wanted to do. Did 2 years at the four-year university in Springfield at SMSU. And then my college roommate was going into the Navy, and they had actually asked her, put her on that pathway of nursing school the Navy was going to pay for. So that intrigued me. And then my sister at the time was a nurse as well. So that encouraged me. So I went into nursing. They did not have a program there at the college, a 4-year. So I did 2 years of my prerequisites there, moved here, married my husband, and went to Johnson County Community College. They had a ADN program there and did the program there, which was an excellent nursing program.
So I started my career back almost 23 years ago in Tulsa, Oklahoma, St. Francis Hospital. Worked there for about 8 years. Then I went into the scrub tech role.
That is our department. It's all about teamwork. We work together with the anesthesiologist, the OR nurses, the techs all together. If one part's missing, it'll mess up the whole process. So from start to finish, when a patient is reached out to from that team and that nursing department that calls the patient and gets all the history and information, they can collaborate together so the doctors can look at the patient's history to make the surgery as safe as possible for them. And then when we all come together on the day of surgery, getting the patient ready in a timely manner, keeping them safe to get them through to the end of their process of their surgery. We worked really well as a team. It's a fast-paced area, but it's a great area to work in. I mean, it's all about teamwork. If one part of the team's missing, someone else there to pick up that slack, but it's better when we're all working together on it. So.
And it's the team that defines how good the program is, how successful the scrub tech is, and the circulator, and the doctor. And if it wasn't for the doctor, we would not have this program. If it wasn't for the patient following the doctor's lead, letting them know, hey, come to Menorah because we have one of the best robotic programs in the country, we would not have this program. So it encompasses the whole team, from a scrub tech to a nurse to the physician and our CRNA.
I think what I look for in someone that has potential to move into leadership or into that role is really the concept of teamwork, and how they handle themselves in a team. Whether that's you're working with your patient and now you've formed this alliance and you two have the same common goal as a team, how do you lead that patient through that? Or how do you take your colleagues and engage them on a case, or how we rearrange something in the operating room, or learning a specialty that you maybe didn't know before. I look for people that really engage themselves, speak up, communication style, very transparent.
Teamwork's the only way we can get our job done, because I can't be in pre-op, recovery, and the OR at the same time to get updates on family members. So the teamwork of having them contact me and communicate, tell me where we're at, makes my job possible.
Highly, highly important. You got to have the communication. If you don't have the communication there, it's not going to be successful. So just in the process of getting a patient ready for surgery, if one starts out and you're missing a piece of information, you got to ask for, go further, ask somebody else, hey, can you help me? Do you know a little bit about this? What can I do to help you in the process to make this successful for the patient? So communication with one another is so important to carry on to the next level, next phase of the recovery for that patient. So you got to have that.
Always being open-minded that just because that's the way we've done it, or I even think that it needs to be done that way, being open-minded to hearing others just opens up the opportunity for everyone to always be learning, always being able to focus on wanting to do the best and moving forward with everything that we do.
What makes my day so great, and I look forward to coming to work every day as I have for the past 25 years working at Menorah, the people I work with, they care for one another, we communicate, we work so well as a team. That's what this is about. You got to have the people or it's going to fail. You can have technology, all the highest tech in the world, but if you don't have that extra caring soul to take care of that patient that's there and scared and hurting, it'll fail every time. So you got to have the people. That's what it's about.
I work really closely with the new grads, the newer nurses, even people who have a little bit of experience, and seeing them grow in their profession and also grow within our department and the relationships that we have here.
What I like about this career at Menorah Medical Center, especially in surgery, is the teamwork, the team environment. Our wonderful surgeons that continuously bring our patients back to Menorah. And I can't overemphasize that enough. We have a good group of leadership, and we have a good group of leadership from an administration level that backs the program. And I believe that's why we've been so successful.
I love interacting with the public. I'm an OR nurse, so it's nice to have awake people to interact with for a change, and to make sure people on one of their scariest days are a little more calm.
Listen to your patients. not just your patients, but your team too. But if you just lend an ear and listen to what they're saying, what's going on in their lives, what can I do to make their day better, to be more successful, and to come out happier and healthier from that day forward. So just listen to your patients, listen to your teammates, be there for them, be supportive, and just be happy. Show that smile, do the best that you can to just care, and it'll come through, and you'll hear about it too.
People do make mistakes. People maybe don't engage themselves how they want to, but owning that immediately, being able to speak up and advocate is a big one. But communication style is probably the biggest thing. Not afraid to engage themselves in conversation, talk to all levels. As in the operating room, we work with people at all levels of education. And so it's very important that you treat pretty much everyone the same and engage yourself in conversation.
I want to welcome our surgery support expert to answer questions about the career opportunities on a surgical team. Joining us this morning from HCA Midwest is Linnea Julian, Director of Surgical Services, who works at Menorah Medical Center. Good morning, Linnea.
Hello. Hello. Thank you very much for having me.
Well, I'm going to start out with a few questions and then
Okay.
we'll be going to our chat. So if students and others are watching us today, I encourage you to get online there in the chat box and put your questions for Linnea. So first question I have though is, what is a board runner?
Okay. A board runner is very similar to a charge nurse on the floor, but the board runner is a registered nurse that takes our surgery schedule, and we do an average of about 35 cases a day here at Menorah throughout our 14 operating rooms. And that board runner just synchronizes and overviews all the things that need to happen for each individual surgery. So they assign a qualified staff for the room. They make sure that everything is on time. We have all the proper equipment. It's really choreographing everything that needs to happen for that patient for each individual surgery.
That helps explain that one.
Yeah.
Well, I wanted to ask another question for you before we turn to our students' questions, but can you tell me a little bit about what your typical day looks like? Like, how many procedures do you personally work on? And like, who else do you work with on a team when you're working?
Yes, absolutely. So each person would be assigned a room, and we on average assign specific talent or credentialed people to each operating room. So each operating room will have one RN who is a circulator in the room, and that is their title. Typically at least one surgical tech. That's the person at the field that's handing the instruments to the surgeon during the procedure. We also have a CRNA, which is a certified registered nurse anesthetist, which is an advanced practice registered nurse in that operating room. So that's the minimum staff that we would have. And then you're assigned to a room each day. I typically would be in a room and I could have anywhere from 3 to 5 procedures that I would do on my shift in that day. And the amount of procedures is really determined about the length or how long it takes the surgeon to do those procedures.
And I'm imagining those procedures vary daily. Is that correct?
Yeah, that is true. Here at Menorah, we do really kind of everything but burns or eyes. So we do orthopedics, we do neurosurgeries, we do complex vascular, we do ENT surgery, urology, GYN, general surgery. We really kind of have a broad base of all variety of surgeries.
Well, that's helpful to kind of understand what a day in the life is. I actually want to turn it over to Jaron, who's been monitoring the chat to see what kind of questions we're getting from students. Jaron?
Yeah, good morning. So let's start off with, how do you prep for something like a 16-hour surgery? And maybe also separately from that, what are some of the tools you usually have to use for surgery, and how many different types of tools are there?
Okay. For a 16-hour surgery, there's many things that we prepare for, and it's all focused around the patient. So if you're going to have a patient in the operating room that's going to be there 16 hours, we have to take into account for many, many things that are going to occur them not only in the procedure, but what ill effect potentially that could happen by being in that same position potentially for 16 hours. So we review all of our positioning devices, the climate of the operating room. We make sure that we put a warming blanket on the patient and continue through that. Determine if we need to maybe place a Foley catheter because they will not be able to void on their own. So those would be the troubleshooting that you would need to think through prior to the start of the procedure. And as far as instrumentation or equipment, every surgical procedure has a minimum of at least 10 to 15 pieces of equipment that are in the room. When it comes to instrument trays, we can have anywhere from 4 to really up to 40 to 50 trays of instruments. And within those trays could be anywhere from 10 to 40 different instruments. So there's actually a lot that goes into a procedure every single day. And the surgical tech is someone that really has to know all of those per the procedure.
Wow, yeah, that's interesting, I think, and helpful to learn. There's a lot of details going on, as you would probably expect. Just have time for a few more. What's your favorite kind of surgery to do? And maybe could you also share what's maybe the most interesting surgery or a case in the operating room that you've had the chance to work on?
Sure. I think my favorite procedure in the operating room is an open heart procedure. I think that it is it's actually all the clinical sides of life really occur during that procedure. We have the ability then to actually open the chest up. We stop the heart, put them on a machine that will take over to act as their heart and their lungs during that procedure, to allow the surgeon to actually work on the heart at the time. There is someone that typically actually holds the heart in their hand so that the surgeon can get to the areas that they need to sew or work on. And then we reverse that entire process in that procedure. So then you get to see everything start working on its own again. So those procedures to me are really actually amazing, that we get to be part of that and that you get to help and assist through all of that. So, yes.
Well, great. And then I think the last one that we'll go to, again, there's a lot of them out here, but it's everyone's very interested in this. So really, what has made you want to work in the operating room and stay in the surgery department, for really most, if not all of your career? And then maybe what would you recommend for a nursing student or others to smoothly transition into kind of following your footsteps?
Yeah, I think what has engaged me my entire career through the operating room is the teamwork. And I know our video spoke so much about it without any prompting. That was what was so amazing to me about the video. But it truly is. It is like no other team that you'll ever be involved in. And I did many team sports and things through music and drama and all those things. But this really is a unique team that works within the operating room. So it's probably the teamwork that has kept me there. The other part is the way that we care for the patients. We actually get to hear and see things that the patient don't even know about themselves. Because we are the first. We are the first to see that, to hear that. And you don't take that lightly. We definitely take great pride in the fact that we want to do the best and have the best outcomes for our patients. So I think that's what's probably kept me in the operating room. I think anyone that's interested in the operating room needs to seek out an opportunity to shadow, whether that's during a high school program that has an advanced program, letting you look at different fields within a hospital. Call a hospital, see if they do have any shadowing programs. Can you volunteer at the hospital? Get in. We have volunteers at our desks that are high school students in college that get to then ask questions, interact with those that are on the surgical team. Here at Menorah, we allow a lot of shadowing. Anyone that's considering a career in the operating room, we set up 4-hour shadow windows for them. So really seek out the opportunity for you to get in and see if you really want to do that.